Hello, everybody. Andrea Majewski here. I am a registered dental hygienist who has been working for about 14 years now, but I now have my own dental hygiene practice where I do teeth cleaning and teeth whitening. So I am going to be talking to you guys about the more commonly asked questions about teeth whitening because spring is now here. I find a lot more people are starting to ask about teeth whitening because they're either planning to go on a trip, they're getting married, they are going to a wedding, or they just simply want to refresh their look overall for the summertime. And ask anybody, we all would probably say that we want whiter teeth. Nobody ever says that they don't want whiter teeth. We all do. So the first commonly asked question is, how much does whitening cost? So with my own business, I do charge $200, and that includes full whitening, meaning you see results right away. It takes about 1 hour, that's it. Plus I give you a tray and a whitening syringe to take home to boost the results about a week later, because it's kind of like your hair. You know, you can do it, it looks awesome, but then it does tend to fade over time. But with the systems that I use, it's a little bit different. I use a mix of carbamide peroxide and hydrogen peroxide. So that helps to make the teeth whiter, but also helps it to last. And then the booster helps it to last even more. So I do something a little bit different. That's a relatively new thing, but it does work. Now, typically at dental offices, and I know this because I still work at 2 of them part-time, they charge about $300 to $500. Yes, there is a big difference depending on what system they use. So I use the same system. I take it a step further to give you guys a booster that is included for only $150. So that's pretty good, right? Right? I would say so. But that's how much things typically cost. And I tell patients, you can get those Crest, the white strips package for $60 to $70, depending on the package you buy. Doesn't it make more sense to spend a little bit more, have your teeth whitened by a dental professional who knows what she's doing and can make sure that you are happy with your new shade? So spend a little bit more and get so much more, right? So that's a very common question. The next question is, well, how does the whitening work? So there are different systems. We call the first system in-office whitening. So that just means that a dental hygienist or the dentist, depending on the office, does the whitening in their chair, and it takes about 1 hour to an hour and a half depending on the system that they use, and then you will see your teeth a lot lighter after that, like right away. But there's another option where you can save some money typically, and that is the booster that I was telling you about. So the take-home option, we like to call it. So there's the in-office option, and 2, the take-home option. So the take-home option is where we would give you a tray or trays for the top and the bottom. The booster that I have, it actually gives you 1 tray that will fit in the top and the bottom the same time. So less time, it's just a lot nicer in my opinion than having to put in 2 trays. But anyways, but that's the take-home option where we would give you the whitening syringe to take home and do that in your own trays at home. So you would typically wear the trays for about a half an hour to an hour every single night for a week to 2 weeks, depending on how light you want your shade to go. So that's another question, is what are the different options? Typically that take-home option is a lot less expensive because you're not taking up chair time and more product to whiten the teeth right away, and you're using less product. So does that make sense? So I do offer both to my patients, but I like to offer the in-office option plus the take-home option, all for $150. So because it's just something that I like to provide for my patients, right? So that's just what I do. Another commonly asked question is, will it hurt my teeth? And does it harm your teeth, harm the enamel in any way? No, it does not. But something to make note of is, and I'll use the same analogy. If you were to color your hair, is that healthy for your hair? Well, no, but is it going to kill you? No. Same thing with whitening. I'm not saying that it's not healthy, but you're penetrating your enamel a little bit, right? So anytime you don't have to put something extra in the mouth is probably better, you know, because it's technically hydrogen peroxide and carbamide peroxide. But do I whiten? Yes. Do I consider I'm harming myself? No. So that's just my real honest answer to that, is it's pretty safe, you know. Is it better to not whiten? Probably, but then you won't have nice white teeth, right? And I've been a dental hygienist for 14 years. I see patients all the time who get whitening every 6 months to every year, and they're fine, you know. But it can make the teeth cold sensitive. So I tell all of my patients, use a Sensodyne toothpaste to use on the teeth. So brush with that twice a day, every day for at least a week to even 2 weeks leading up to the time that you are going to get the whitening, because that will actually help to prevent cold sensitivity. If you're saying, well, I'm not cold sensitive, I would still spend the extra money to buy Sensodyne. So then that way you know for sure that you're not going to be cold sensitive, because remember how I said whitening penetrates your enamel, right? So it's not, you know, you don't want something to penetrate your enamel, but that's how whitening works. So that's why people can be a little bit cold sensitive. Not all the time, but typically. But I can say the patients that I have suggested to use Sensodyne and the ones that do use the Sensodyne, they're not cold sensitive. So talk about awesome, right? Another question is, if you are getting married, when should you whiten? Do not whiten the day before. It's not the end of the world if you do, but if for some reason your teeth are cold sensitive, if you have a reaction to the whitening, which never happens, but it could happen because it's a, you know, hydrogen peroxide, you don't want to have to deal with that the next day for your wedding day, right? You don't want to lose sleep because your teeth are just so cold sensitive. So I tell people to whiten at least 1 week to 2 weeks before the big day. Typically when I go do the wedding parties, it's about 2 weeks before, because a week before, they're all doing something else, right? The bride has stuff to do, you know, the bridal party, the wedding parties, they all have stuff to do, so they don't even have time for even me to go to them, but they're doing other things, right? So I typically tell bridal parties that I will come to you about 2 weeks before, just so that way it's not too far out, so the teeth do look as white as possible. Plus, I do give everybody that tray and the booster syringe to whiten about a couple days before anyway, like just to give it that new teeth white look, if that makes sense. What else? What system should you use? This is what everybody's asking me. Every dental office has a different system. There are so many different systems out there, but the differences are some of them take 30 minutes, some of them take an hour, some of them take an hour and a half, some of them use a light, some of them don't. You know, I find just every hygienist has a preference. I have used probably 4 whitening systems in my 14 years experience, and I am using the one now that I like the best, that seems to yield the best results and does not make the teeth sensitive. So it took me time to kind of find that happy medium, right? And I'm a portable dental hygienist too, so I don't want something that needs a big light. I don't want something that takes 2 hours to whiten, because I don't want to just hang around for 2 hours, right? Nor does the patient want me to be there for 2 hours. So I had to find something that was an hour or less. I do have a light, but it's a handheld light. I take before and after photos. People love that, and it works. It's amazing. But trust me, that took time. Like I as I mentioned, I have used a variety of systems, even a couple systems that I had used in a dental office. I did try for my patients where I travel to, and then I thought, oh, you know what? I don't really love this. Like, I don't love the results it's giving me, you know? So if I'm not happy, then my patients aren't going to be happy either. So I did kind of switch things up, change things around, and now I am super duper happy with the system that I do have. What else? Oh, how often should you whiten? That's different for everybody. Again, it's the same thing as coloring your hair. I get my hair done probably every 3 or 4 months. I would love to go every 6 weeks, but I just don't have time for that, don't have the money for that. So I get my hair typically done every 3 to 4 months. The whitening's the same. It just kind of depends on when you look at your smile and say, oh, you know what, I'm not really happy with this. I'm going to touch it up. The nice thing is if you buy that full whitening package, say the one that I have for $150, the touch-ups are so much cheaper. The touch-ups are 20 bucks. That's it, and then that will give you lighter teeth once again, you know, because I will give you the refill syringe to use at home, 20 bucks, that's it. You have perfectly white teeth once again. So a lot more cost effective than the Crest white strips because they don't offer you touch-ups, right? And they don't really work as well either because the trays are, the strips are not customized for your mouth. So be careful with that. Another common question, speaking of white strips or pretty much any company, is why is the whitening so expensive in the dental office when the Crest white strips or other systems are like $30, $60? Well, it's because over-the-counter products, they can only use a certain percentage of hydrogen peroxide, usually up to 1 or 2%. In office, our percentages start at 10% up to 35%. So I check to see what shade you have now, and then I will determine what syringe, what percentages you need to get the teeth lighter. So if you have a very average shade, a 10% hydrogen peroxide might be enough to get very, very white teeth. If you've been smoking for 10 years, you might need upwards to a 35%, right? But again, Crest white strips have up to 2% hydrogen peroxide. The ones that I can give you are 10% up to 35. So gee, I wonder which one does a better result, right? So that is something that not a lot of people know. Do the whitening toothpaste work? That's a fun one. So whitening toothpaste do take off surface stains, honestly. There's a whitening toothpaste actually that I like because it takes off surface stains, but it does also coat the teeth afterwards so that more stain can't get back in. That toothpaste is amazing, but typically the whitening toothpaste do not work because they tend to be more coarse, more abrasive. So yes, they take away stain, but more stain comes back because now the tooth is more coarse. So it's just better to get your teeth whitened with a dental professional. If you guys have any more questions, please let me know. I am so happy to help, and I will see you guys in the next one.